What if the drink you call harmless is quietly rewriting your brain, reshaping your habits, and narrowing your freedom without you even noticing? In your 40s and 50s, life feels structured, earned, and deserved. You have worked for decades, built a career, supported a family, paid your bills, survived disappointments, and celebrated milestones. A glass of wine after work, a few beers on the weekend,
Why do I look so
a cocktail
tired?
at dinner with friends.
I need to make a change.
These rituals seem normal, even sophisticated. They appear to symbolize balance, adulthood, and control. Yet midlife is precisely when alcohol can begin to change from a companion to a captor, not through dramatic collapse, but through slow adaptation inside the brain's reward circuitry. The human brain is wired to pursue pleasure and avoid pain. Alcohol delivers both relief and reward in a single dose. It softens anxiety, dulls stress, enhances social confidence, and briefly quiets the relentless mental chatter that often intensifies during midlife. Career pressures peak. Financial responsibilities expand. Parents age. Children need guidance. Relationships evolve. Health concerns emerge. The brain, seeking efficiency, begins to associate alcohol with relief from these cumulative burdens. Over time, the dopamine system recalibrates. What once produced a mild lift now feels necessary just to feel normal. This is not a moral failure. It is neuroadaptation. Tolerance develops quietly. One drink becomes two. Two become three. The body metabolizes alcohol differently in midlife. Lean muscle mass decreases, body fat increases, liver function becomes less resilient, and the same amount of alcohol produces stronger physiological effects. Sleep becomes fragmented, yet the drink that seems to help you fall asleep actually suppresses restorative cycles, leading to early waking, anxiety, and fatigue the next day. You may attribute this to stress or aging, never suspecting the chemical contributor in your nightly routine. Clinically, alcohol use disorder is not defined by how often you drink, but by how your drinking affects control, craving, and consequence. Have you tried to cut back and found yourself returning to old patterns? Do you think about your next drink earlier in the day? Do you feel irritated or restless when alcohol is unavailable? These are not dramatic rock-bottom scenarios. They are subtle signals that the brain is adapting. In midlife, drinking is socially sanctioned. Networking events revolve around bars. Celebrations center on champagne. Even self-care is marketed as a glass of wine in a quiet house. Because it is normalized, early warning signs hide in plain sight. Responsibilities are still being met. Careers continue. Families function. From the outside, everything looks intact. But inside, the relationship with alcohol may be shifting from choice to compulsion. The danger is not immediate catastrophe. The danger is gradual narrowing. Activities that once brought joy without substances begin to feel less stimulating. Stress feels sharper without chemical relief. The brain's baseline dopamine level drops, making ordinary life seem dull. What began as a tool to cope slowly becomes the architect of discomfort it promises to soothe. Understanding this transition requires courage, because it challenges the narrative that midlife drinking is harmless tradition. It invites you to examine patterns rather than excuses, neurobiology rather than willpower, and long-term freedom rather than short-term comfort. By the time most people begin to suspect that their relationship with alcohol has shifted, the evidence is rarely dramatic. It is cumulative, layered, and disguised as normal midlife strain. You may still be excelling professionally, showing up for family obligations, maintaining friendships, and managing responsibilities. Yet beneath that functional exterior, something feels slightly off. The drink that once marked celebration now marks survival. You tell yourself you deserve it because you worked hard, because the day was exhausting, because everyone else drinks too. And for a while, that reasoning feels airtight. But the brain keeps meticulous records. Each episode of drinking reinforces a loop. Stress arises, alcohol relieves it, dopamine spikes, and the brain encodes the association. Over months and years, the baseline reward threshold shifts downward. Ordinary pleasures, exercise, conversation, hobbies, quiet reflection, no longer produce the same satisfaction. This is the silent pivot point, the moment when relief turns into requirement. Suspense enters here, not as a dramatic crash, but as an invisible narrowing of options. You may attempt to cut back, declaring that you will only drink on weekends or only have one glass. The first week goes well. The second week is harder. A stressful meeting, an argument, a wave of loneliness, and the rule bends. The brain interprets this not as failure, but as confirmation that alcohol is essential for equilibrium. Cravings become more cognitive than physical, appearing as persuasive thoughts. Just one. You can handle it. Tomorrow will be different. Meanwhile, subtle physiological consequences accumulate. Sleep becomes shallow, waking at 3 a.m. with racing thoughts. Blood pressure inches upward. Liver enzymes quietly elevate. Anxiety that seems situational grows more persistent. Mood dips feel heavier and more frequent. The paradox deepens. The very substance used to manage distress amplifies the distress it is meant to solve. In clinical terms, alcohol use disorder is diagnosed through criteria such as impaired control, craving, tolerance, withdrawal symptoms, neglect of roles, and continued use despite harm. Many midlife adults meet mild or moderate thresholds without recognizing the pattern, because the cultural image of addiction does not resemble their lives. They imagine collapse, not subtle compromise. They imagine chaos, not controlled functionality. Yet functional dependence is still dependence. The brain does not distinguish between a high-achieving executive and someone unemployed. It responds to repeated chemical reinforcement the same way. There is a moment of reckoning that often arrives quietly. Perhaps it is a medical appointment where lab results prompt concern. Perhaps it is a child noticing how often you refill your glass. Perhaps it is the realization that you cannot remember the last weeknight without drinking. In that moment, uncertainty surfaces. Is this just stress, or is something deeper unfolding? The suspense lies in the choice that follows. You can dismiss the signs, normalize them, and continue the pattern, allowing neuroadaptation to tighten its grip. Or you can pause, examine the data of your own life, and confront the possibility that what feels like comfort may be costing you autonomy. This is not about shame. It is about awareness. Awareness disrupts automaticity. Awareness opens the door to change, but only if you are willing to step through it. Stepping through that door requires a different kind of strength than enduring stress or maintaining appearances. It requires the willingness to experience discomfort without immediately anesthetizing it. When you begin to reassess your drinking in your 40s or 50s, you are not simply modifying a habit. You are recalibrating a reward system that has adapted over years. The first days of reducing or abstaining can feel unsettling. Anxiety may spike. Sleep may initially worsen. Irritability can surface. This is not evidence that you need alcohol. It is evidence that your brain is recalculating. Neuroscience shows that with sustained reduction or abstinence, dopamine pathways gradually restore sensitivity. Baseline mood stabilizes. Natural rewards regain their color. The key is understanding that the discomfort is temporary, but the freedom is durable. Clinicians emphasize structured strategies rather than vague promises. Set a defined period of abstinence, long enough to allow neurochemical stabilization. Remove alcohol from your immediate environment to reduce cue-induced craving. Replace the ritual, not just the substance, by scheduling exercise, connection, reading, or reflection during the hour you previously drank. Track sleep, mood, and energy to observe objective change. Seek medical guidance if withdrawal symptoms such as tremors, sweating, or severe agitation appear, because safety is paramount. Evidence-based therapies such as cognitive behavioral therapy and motivational interviewing help identify the thought patterns that justify continued use. Medications like naltrexone or acamprosate may reduce craving when clinically appropriate. Support groups provide accountability and shared insight, counteracting the isolation that often sustains dependency. The philosophical dimension matters as much as the clinical one. When experts like Dr. Anna Lembke emphasize the balance between pleasure and pain in the brain, the message is not prohibition, it is equilibrium. Every artificial spike in pleasure is followed by a compensatory dip. When spikes become frequent, the dips become the new baseline. Choosing to reduce alcohol is choosing to stop borrowing dopamine from tomorrow. It is choosing long-term stability over short-term sedation. In midlife, this choice carries amplified significance because the body's resilience is no longer infinite. Cardiovascular risk, cognitive decline, metabolic changes, and liver vulnerability all intersect with alcohol exposure. Protecting your brain now protects your future autonomy, memory, and vitality. Imagine reaching your 60s and 70s with mental clarity intact, sleep restorative, mood steady, and relationships unclouded by chemical dependency. That future is shaped by decisions made quietly in the present. There is dignity in self-examination. There is power in interrupting a pattern before it escalates. Alcohol use disorder does not announce itself with fanfare in midlife. It whispers through habits, rationalizations, and cultural norms. Recognizing the whisper is an act of courage. Acting on it is an act of self-respect. You are not depriving yourself by reassessing alcohol. You are reclaiming agency over your reward system, your health trajectory, and your emotional resilience. The transformation may begin subtly, with one alcohol-free evening, one honest inventory, one medical consultation. But momentum builds as clarity returns. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.